Good morning, everyone. We were just giving a minute so all participants can get logged on and we will get started. All right, it looks like many of you are getting logged on, so let's go ahead and roll forward. So good morning. Dr. Cage and I would like to welcome you to our conversation today on systemic racism, disproportionality, and equity in our child welfare, our history, and where to focus our change efforts. My name is Naomi Reddish, and I coordinate the Title IV-E Child Welfare Stipend Program here at VCU. My practice experience prior to my work within the School of Social Work was in public child welfare, so this topic is really important to me.
Thank you, Naomi, for getting us started. My name is Dr. Cage. It's so weird. Jamie Cage is what I much prefer. And I am an assistant professor here in the School of Social Work, and my research really centers youth involved with the child welfare system and focusing a lot on their educational experiences and attainment. So Naomi and the students involved in the child welfare stipend program invited me to be a part of this. So thank you to you, Naomi, for always reaching out. So we've been hearing a lot about the conversations of social workers and their involvement in our current climate and the current things that are happening in our country. And the struggle for equity across many intersecting systems, including the child welfare systems and all the state systems and agencies that intersect with the child welfare system. So today, with this conversation, we wanted to begin discussing that with you all. And how there is a need to address systemic racism and equity within the child welfare system. Because while many of us really believe in equity and working towards equity, the question is, how do we really accomplish it? What are the steps we need to take to make that happen? Where can we put our focus? And what steps can we take in the current role to ensure that our systems are working for our families of color? And I want to just quickly say, yeah, in this conversation today, we're going to say families of color, not to group all non-white people together, but because we're not specifically talking about one group of non-white individuals, we're using families of color. But when we specifically talk about one group, we will name that because we understand that all families of color are not a monolith. So if we're talking about Black children and Black families, we're going to name Black children and Black families. But while we're talking about all non-white children and families, today we will use the term families of color.
Thank you, Jamie, for framing that for us. So I wanted to, in our welcome, just really let you know again that at VCU School of Social Work, our mission is guided by the principle of promoting social and economic justice in a diverse and multicultural society. Our programs focus on service to and empowerment of people who experience oppression or vulnerability due to inadequate or inequitable distribution of personal, social, or institutional resources. And so another reason this conversation is really important to us today is because it directly aligns with our mission. So we had initially planned to have this conversation as a part of a continual learning experience for students who are specifically focusing their social work education on public child welfare. And then after some thought, really decided it was an important conversation to have with the larger School of Social Work community, as many of us work in areas of social work practice and research that provide supports and services to individuals and families who are or have been involved in the child welfare system, whether we think of ourselves as child welfare workers or not. We're all a part of this system and serving children and families in our communities.
So, we're going to get started soon, and we really just want today to have a robust discussion that starts today and continues on about our history and leads really to the overarching question of, how can I, as a social work practitioner or researcher, be an active change agent in the child welfare system? So today we've invited some of our alumni who are currently working in the community and within our state agencies to have this conversation with us and to really begin focusing on these topics. And our students are going to introduce them to you all shortly.
So first, we're going to introduce our moderators for today, which are two of our current and wonderful MSW students and are also participants in our Title IV-E Child Welfare Stipend Program here at VCU. So I would like to welcome now Abigail Osei. She has a bachelor's in psychology and is a current clinical specialization student, and as I mentioned, in our Title IV-E Child Welfare Stipend Program. I would also like to welcome Johnny Ruing, who holds a bachelor's in social work and is a current social work administration policy planning practice specialization student, and is also a Title IV-E student. Both students are also currently completing their field work in child welfare settings at local departments of social services. And so this conversation is also important to them in their work. So now I'm going to hand the conversation over to you. Thank you, Abigail and Johnny.
Thank you, Naomi. Good morning, everyone. Thank you so much for joining us today for this important conversation. But before we begin our panel discussion, we would like to take a minute to go over the structure of the webinar today. One of our panelists will start by providing the history of the child welfare system. Then we will move into the panel discussion session to delve more into systemic racism and disproportionality and discuss some strategies for change. At the end, we will have a Q&A session, so please add your questions at that point and we will address them later on. We will share a recording of this webinar and additional resources with you via email, as well as a feedback form.
Now, we would like to introduce the wonderful panelists who are with us today, all of whom are VCU School of Social Work MSW alum. Up first, we have Danica Briggs, the Assistant Director for Chesterfield Colonial Heights Department of Social Services and a Child Welfare Stipend Program alumna. Up next, we have Allison Gilbreth, the Policy and Program Director for Voices for Virginia's Children. And finally, we have Kristen Zagar, the Director for the Division of Family Services for the Virginia Department of Social Services and a Child Welfare Stipend Program alumna. Thank you all for being with us here today, and we look forward to having a great discussion about how we can better support families. But before that, Allison will begin by providing us some historical context about the developments of the child welfare system.
Thanks so much, Johnny and Abby, for those wonderful introductions. And thank you to so many of you who are logged on today because you care and you're interested about this topic. I think it's really important for me to preface a part of my identity that wasn't introduced in that wonderful introduction, which is I'm also an alumni of the Virginia's foster care system, and specifically our kinship care system. For me, that guides who I am as a person. It guides part of my perspective of what I'll be talking about today. And I think it's really important that I share that aspect of myself with you all. As we have this conversation, if you've met with me in person, you know that I talk with my hands. I'm an interactive person. I'm like, yes, tell me everything. So I love interaction like that, even on Zoom and the chat. Tell me why you're here. Tell us why you're here. It'll be great for our co-panelists to be reading some of those in the chat. What motivates you? Why are you interested in this topic? And so I wanted that to preface all the things that I'm going to be talking about and the history with that. I want to start us actually with a really wonderful quote by Erin Cloud. She writes, "If we can agree that implicit bias and racism are at least part of why our society is more likely to shoot a Black person, call the police on Black people, or profile a Black body, why do we believe that there are more noble reasons for the disproportionate reporting of Black mothers and the removal of Black children?" There's a lot to unpack in that quote, so I wanted to sit with you for a moment as I walk us through some of the history of our child welfare system. Now, of course, we don't have time to go through every single bullet, but I hope that throughout this conversation, we'll have time to really dig into this. So I want to actually start at slavery, at a time in our country's history where people of color, families of color, did not have any rights over the welfare of their children. And just as we know that children who are removed today from their homes experience trauma, just let alone from that removal, the trauma of watching your children being sold on auction blocks, being beaten, being removed from your care, sometimes removed as you are giving birth, that trauma is started in part in our country's history during slavery, and it has impacts on our child welfare system even today. And so even after Black and Brown families started to be known in our country as citizens, we know that many of those families and people did not have the same access to rights that white people did in this country. And we know that because they didn't have same access to those rights, they also didn't have the same abilities to navigate our society in the way that white families did. And so one of the major impacts that I'll talk about in this time frame in our country's history was the intentional pushing out of Black and Brown families. And I'm going to start with redlining. So if you're not familiar with redlining, and I know we have lots of wonderful School of Social Work students who are still learning some of this history today, redlining was this concept where they looked at a map and decided a community's worth, their home values based on the percent of typically Black people, but there were other groups in that category, how much those communities and those homes were worth. So let's talk about that, and maybe just in Richmond, Virginia, because a lot of us are familiar with that city that are on this webinar. If you look at just Richmond, Virginia, and you look at the neighborhood of Jackson Ward, you will see where they built the I-95 highway that went straight through that neighborhood, and what was a thriving middle-class Black, mostly Black neighborhood, the home values decreased significantly, some upwards of 50% of the home values. Those families were then unable to navigate or move up in financial standing because they weren't able to sell their homes. At the same time, because of things that were still going on, the impacts of Jim Crow era laws, we also saw what was known as white flight. So white flight was this concept of white families moving out to the outer suburban counties, sometimes more rural communities, to disassociate with the urban community. Often more people of color lived in those communities. It also hurt them financially for many reasons. And then for example, when families of color were not able to access getting a loan because there was actual institutional racism within our financial institutions as well, where families were not able to access loans at the same interest rates, sometimes beyond interest rates, or they were only able to access loans for homes that were in lower income communities for those families to be able to live in, limited those families' access in where they lived and chose to live. That also limited their access to where they were going to be able to go to school, where they were going to be able to access certain jobs based on the ability to have access to transportation, access to safe neighborhoods, and of course, access to affordable housing and therefore lack of that access. At the same time, and I'm moving us a little bit further along in our history, in the 70s and 80s, we saw a sharp increase in what we now know as social services. And when I refer to that, I'm talking about TANF and SNAP. Some people might refer to that as food stamps. All of those kind of services started to become more populated. This was also happening at the same time as a lot of School of Social Works were also starting to see creation or increase in enrollment. So we have these two systems kind of happening at the same time, where we have more federal laws are getting passed that have financial support available to low-income families, and we also have schools of social work that are at the time almost all white students are attending those programs. So what the caveat to those social service programs that also has tenets of racism is that those programs were essentially attached to the surveillance of Black and brown families. They required sometimes home visits or checks, or are you purchasing the right things with the right money? Even if there was cash assistance, those communities became monitored. This also, and you're going to keep hearing this, all these things coupled at the same time, was coupled at the same time as mass incarceration. So this is also at the time of the war on drugs, which also created over surveillance by police into lower income, often Black communities, where those communities were now being surveillanced because of some services that they were receiving, over surveilled because of greater law enforcement presence, and therefore more likely for children in the community to be connected to the child welfare system. The challenge with this subject is that oftentimes, and going back to that quote that we were talking about, the foster care system and child welfare system is often thought to be the savior, the hero. Sometimes we even know our students, and I'm also another hat that I wear, an adjunct professor at VCU, our students go into social work because they want to help, because they want to change, without the knowledge of understanding of how these systems were created. So if you were a child welfare worker in this time and your job was to go in and investigate, but you had no idea that the reason you were continually investigating a particular neighborhood or community was because that community was under over surveillance, there was a connection to that problem that wasn't addressed. And it's important to note also too, that during this time frame of the 70s and 80s when these social services were available and mass incarceration, at the same time I was talking about with the School of Social Work, we also implicitly got into what makes a good family. This is so integral into this topic. When you think of what makes a good family, sometimes we think of two-parent household, safe neighborhood, access to food, access to safe schools, or not necessarily safe schools, but good schools, things like that. Sometimes those things are what we see in our current foster families. It's the typical recruitment that we do. A lot of our foster parents tend to be white. And the structure of how we answer that, what makes a good family, it can be defined sometimes actually all the way down into our guidance, into our codes, into our laws. And it sometimes results in a greater percentage of children of color being referred into child welfare as opposed to other races. And it is also important for us to note when I'm talking, all of these things I'm talking about, very rarely did you hear direct action from the child welfare system. This is so critical because in order for us to strategize and talk about how we are going to change the system, we have to recognize that there are other systems that are impacting the child welfare system that have caused these disproportionate rates of entry for children of color. And we have to talk about the whole system. We have to talk about the power that is inherent in when we're talking about racism as it impacts any particular system. And Abigail has a visual that I would like to show to sort of sum up this conversation. Thank you, Abigail. And it might be a little hard to see for some of your eyes, so you might want to click on your Zoom button just a little bit, and then scroll down to the bottom. So this visual was created at Voices to help us talk about, if you could scroll up just a little bit so we can see the very bottom, thank you, to talk about how we typically look at foster care. We tend to look at some of these, and I'm getting questions, will this visual be available? It isn't on the Voices website. I can make it available and I can also send it to Naomi to send out afterwards. The purpose is we often tend to get at the issues that are on the leaves of this tree. We know that about 500 youth are aging out of foster care every year. We know that we've had a history of lack of kinship supports. We've had greater emphasis on adoption versus reunification, lack of support for Virginia tribal communities. We tend to go at these leaves. What we don't tend to look at is what were the root causes of these leaves? Because if all we're doing is clipping one leaf at a time, they're just going to sprout into another problematic issue. Instead, when we look here in our root cause, we see white supremacy, structural racism, school funding formulas that are based on property taxes, TANF time limits, public housing, family court laws. For example, one of the things that keeps a lot of families historically involved in our child welfare system is when we look at the requirements for reunification. Some of them are astronomical requirements, but sometimes it's really the timeline. When we're thinking about a family that has substance use disorder and we're expecting for them to not have a relapse within 18 months, we all know from brain science that that's typically not going to happen. Relapse is often part of recovery. And so we're not addressing the root causes of that problem. So then we're just seeing lack of permanency for family, children aging out of care. And then when we look at the trunk of our tree here, we're seeing cultural biases for child rearing. Again, when I was talking about what makes a good family, if all you're talking about as an agency, whether you're a private foster care agency or a public agency, is Black hair, that is not it. I'm trying to convey to folks that is not the crux of the issue. And that tends to be where the conversation begins and ends. But we have to start here at the bottom of this tree. We look at majority white staff, we have to talk about it, talk about the racial biases in the workplace. And I talked about, expedited termination of parental rights. And then that's when we get into the leaves of this tree, the outcomes that we tend to zero in on and focus on as organizations. And I think it's important to say, even myself, I have had to take a step back and say, why am I only focused on these leaves? I have to think about the trunk of these issues and how, as an organization that I work for, we're going to do a little bit more or a lot more to address these root causes. And so I wanted to start there as a kickoff to our conversation, as we're going to have a great panel discussion about all of these things that I just gave a very brief history on all of the different systems that are impacting child welfare, really starting at slavery and working our way up. And I want to acknowledge the greatest civil rights movement in my lifetime that just occurred this year, and how it has greatly impacted and started these conversations. And in some areas of Virginia and the child welfare system, this is the first time they're having these conversations. So grateful to be here today and grateful to be here with state representation and local representation. So with that, I'll kick it back over to our moderators.
Thank you, Allison, for that thorough information about the historical content and the development of the child welfare over time. But before we continue, I would like to say, if you want to send a comment to everyone, please make sure you pick panelists and attendees. Otherwise, the audience may not be able to see what you're saying. And also going forward, I would like to take a minute to define what we mean by child welfare system in our conversation today. So when we're talking about the child welfare system, we might typically think about the public child welfare system or Department of Social Services or Department of Family Services. However, for our conversation today, we're going to define the child welfare system as a much larger service community that includes child serving agencies, including nonprofits, mental health or healthcare, education, juvenile justice, and many others that provide wraparound services to our children, youth, and families in our communities. So we will now open it up to all the panelists and ask some questions. But before, it will be important and helpful to discuss the scope of the issue and what it currently looks like. So after hearing from Allison on the history and developments over time, how should we be teaching the history of racism in child welfare and child welfare stipend programs?
I really appreciate just the historical context that Allison provided, because I think a lot of times when we're looking at different events, it's presented more like a timeline, that this happened and then this happened and then that happened, when really there's an interconnectedness between all of these events. And so that summary, Allison, just really helped to show that there's a cumulative effect that different policies and different movements have on our citizens, and especially, people of color, and that it's really important that we appropriately give context to these events, and that's part of increasing awareness. And so I love the image, the visual of the tree, because you're right. We start at the top. We start at the leaves, not looking at the impact of the trunk and the roots on the families that we're serving. And so that piece, that education, that awareness it really is sort of the first step in us being able to make a positive impact.
Thank you, Danica. And I'll add to that. I hope there are some professors from not just VCU, but from all of the schools of social work who are watching or will watch today. I think we also have to talk about decolonizing our syllabus. We tend to teach in a format that was created by and for white folks. And so we have to look at how are we bringing these issues to our classroom without re-traumatizing our students, having good conversations and dialogue, recognizing where individuals are, and talking to our schools about why our program looks the way that it does. Why do we have such a small percentage of students of color? Or why not, having some of those conversations, I think, is really good on both ends.
Those are some great conversation points. And in continuing to talk about education, we hear the term disparity and disproportionality often in these conversations. How would you define disparity and disproportionality and their connection to the child welfare system?
So I will go ahead and take a stab at addressing that. What we do at the Virginia Department of Social Services is we've adapted several different definitions. The definition I'm going to talk about comes specifically from the Center for the Study of Social Policy, and we're happy to put out that information in those links. But also, there's great information that comes out of Annie E. Casey out of Baltimore in terms of defining and definitions around data and around disparities and disproportionality. So what we'll do is, Abby, if you could share the visual that we have here. So one of the ways I thought we could talk about looking at disproportionality and disparity would be to look at some of the data from Virginia. We partner very closely with Casey Family Programs, which is out of Washington State, which is different than Annie E. Casey that I just talked about, that is out of Baltimore. They're sister companies, but they are different. And so with Casey Family Programs, they work with us to look at our data. And what this slide shows is the difference of disparity and disproportionality in Virginia. So let me just go ahead and give some definitions. In terms of racial disparity, and again, this is from the Center for the Study of Social Policy, it's an unequal outcome of one racial group experiences as compared to the outcome for another racial group. So that's disparity. It's an outcome that one group experiences as compared to another. Whereas disproportionality is the underrepresentation or over-representation of a racial or ethnic group at a particular decision point, event, or circumstance in comparison to the group's percentage in the total population. So disparity looks at the total population, disproportionality looks at the total population, where disparity looks at within. So on the slide, what this looks at is the first bar, and I know it's small, and we're happy to share this out. But the first bar shows a population in Virginia. And I should clarify that whenever we talk about data, we're always going to cite our references, and we're always going to cite the year that the data represents, because in child welfare, sometimes our data is about a year behind. And so this data in particular represents 2019. So this shows Virginia's population. And as you can see, the differences in the color code that they had. So when we're looking at African-American, Black families and individuals and children, that's represented here, you can see represented in the blue. The next bar looks at poverty. So this looks at as compared to the whole population in Virginia. So this really sets up the disproportionality section of this. So as we look across, the next bar looks at the number of children that are called into the system and that are investigated or have cases with the child welfare system. You can see it says child welfare on there, but really what we're talking about at that point is the front end on CPS. As we move through, we see that the children who are entering into foster care, we see the children who are in care over time, and then we see the children in care and youth in particular that are exiting. And Allison talked about that in her conversation about the 500 or so youth that exit care, about 24% of the youth in care. And so as we can see that the longer Black children and youth are in care, the higher we get in disparity. And the higher we get in disparity with the aging out youth. And so this is really, really important to take a look at and really understand how disparity and disproportionality work together when we're looking at data. So I will continue to talk about data and the impact of data as we move through this conversation. But for now, I'm going to go ahead and turn it back over to Abby, and we'll revisit the data on the other side.
Awesome. Thank you so much, Kristen, for the definitions and the statistics that you shared. They're definitely useful in this conversation. Allison definitely touched on this in her presentation, but for the sake of clarity for all of the participants of this today, what are some factors that contribute to disproportionality in the child welfare system?
I definitely think that, one of those factors are people's biases. In that, families who live in poverty are scrutinized more closely. And Allison mentioned just the surveillance that happens, with those families. So when we think about, our Child Protective Services referrals that we receive, we tend to receive calls from schools that are in lower income communities. Well, we know that child abuse and neglect, it occurs in all communities. It transcends race and socioeconomic status. But why do we see pockets of it in certain parts of our community? And that disproportionality in terms of who actually comes to the attention of our system, as you can see from the chart that Kristen discussed, it's further exacerbated as that child and family continues to move through that system. But then the other thing that I think really contributes to this is in terms of the structures and the systems that we have in place. So when you think about it, if you have a child who's in need of mental health treatment and the family has private insurance, they're likely to go to a therapist's office at least once a week for a 50-minute session. If you have a child in a lower income community who is in need of mental health services and they have Medicaid, they qualify for intensive in-home services where someone is coming to your home up to 10 hours a week. That's another level of surveillance. When someone is in your personal environment for that amount of time, that increases the likelihood that something would be seen. So that's sort of an unintended consequence in terms of someone receiving treatment who is of is lower income, is that there's that increased surveillance where they're more likely to be reported for an incident of abuse or neglect. And that's just the way that the system is set up.
Tamika, you make such an excellent point. And as someone who does public policy for a living, we're always trying to talk about the unintended consequences. However, public policy is more often than not legislated because of crises. So there's a crisis in child abuse and neglect, therefore we put in our dollars in the reaction to that problem instead of to the prevention of that problem. The prevention of that problem would often require us to dig deeper and further into why the trauma, child abuse, and neglect was occurring in the first place. It would also force us to recognize that a lot of the times it's not really child abuse and neglect, it's poverty, which is what you were just talking about. And the willingness of folks to address poverty is a whole different level of issue, because it would require us to say, it keeps certain individuals, certain communities in power when there is a large group of people who are in poverty. And so it's challenging to get additional prevention dollars. I know as an organization, we have been trying very hard for a really long time to get more prevention dollars to local departments of social services. But even more than that, we know that if you ask a family right now who is extremely stressed out because of COVID and all other kind of things, if you're stressed out, they're probably going to say yes. And then if you ask them, would you call the Department of Social Services for help? Their answer is probably going to be absolutely not, because then they know that they're probably at risk of surveillance or different things like that. So we also have to expand our how we provide services so that it's not punitive in response, but truly in the form of helping families and where they're meeting them where they're at. That's not going to trigger a punitive response.
So I wanted to build off of what Allison said, and I think, I think this point is really driving home and bringing together the top of the presentation where Allison really broke down the history and really what is driving a lot of our policies and practices, and then looking at that poverty. And on that slide I showed, you could see the disparity just in the poverty right there. And so how do we really separate out as a system poverty versus abuse and neglect, right? So not having food or not having a house isn't abuse and neglect. Withholding food or not letting somebody in a house, that's very different, right? And so really, how do we really separate that out? And for the child welfare system, it's quite paradoxical, because at the same time you want to address well-being, you also have to really pare down to what does that really mean? So one of the things that I thought would be helpful and really kind of looking at from a point of picking up on the history that Allison was talking about child welfare is, what is child welfare's role and responsibility in owning up to that history and owning up to the systemic racism that we all are working in, right? And so for a lot of you who are students and who are going into this work, what I want to say is, specifically in child welfare, I want to say this is the time for you to go and for you to come into this profession and make such a difference. And right now we have the doors open, we have people listening, and we have the permission to really look at systemic racism, to look at white privilege. And for white social workers and white child welfare workers, for myself to really understand the power, the privilege, the system that we work in, that we've grown up in and we built. And what do we need to do to really have the courage and be curious and be bold and really understand how can we look at this? And sometimes it takes us to go out of our comfort zone and really look at this, because we all went into this to do good. We all went in this to advocate. And at the same time, we're in systems that are not advocating fairly and are not doing what we set out to do. And it's important for us to take a look at that. And I think really looking at systemic racism and looking at our data and looking at data tracking, right? And so we need to know the data. I just showed you the data. It's very helpful to know the data. But data tracking has a history that is not equal, that is not good. It led to redlining. It led to the financial issues with getting loans, right? It led to those things that that brought us to this place we are and that we're dealing with now, and looking at really how did we get here with all the good intentions that we had as a system? And I think that's the piece that we have to call ourselves to do and call ourselves to action. And I think students coming out of this, really be able to take this and boldly move this forward so that we can make these changes and really look at becoming the kind of system we want to be, and an anti-racist system, right? And really looking at it from the micro, the meso, and the macro views that we can, and how do we all work together? The state and local departments work very closely together. Allison and some other partners that are on this call, I think we talk every single day. I don't even know, so much trying to bring this together. And the reason is because we know that it's time for change, and there's a call to do something different, and we're all standing here and ready to do that. The question is, and I think Abby or John, you're going to ask us, how do we do that? So I'll pause here so we can move forward, but I just wanted to jump in there and support that there is white supremacy, that there is white privilege, and that we need to look at our systemic racism to be able to really understand where we are, what we need to change, and get to the root, like Allison was mentioning.
Absolutely. Thank you all for your insights into this. As we move forward, along with systems change, direct practice strategies for change are very important, because that is where families' experiences usually begin. Now that we have talked about the impact of systemic racism in child welfare and described its disproportionality, what strategies are the state and local agencies in Virginia using to address these issues?
So I'll jump in here, and then I know that Danica has quite a bit to add, and certainly I want to be clear that with this macro approach that I'm discussing, this happens with our partnerships and with all levels. But I think that when we're really looking at this, there's really four main areas I think that we can start with. And these are both short and long term, but really looking at our data, our policy, legislation, and practices, workforce probably goes first, and then partnerships and collaboration. And so, like I said, when we're looking at our data, we talked about the need to understand disparity and disproportionality, and looking at that data and understanding data collection methods and what that does and how that can be used, and why there's mistrust in people providing information. Also, for us as a system, how do we ask folks about their race, about how they want to be categorized, what category they want to be put in, at a federal category, at a state category? Those are all different. And do we want to fit in that box? Do we fit in that box? And how does that impact our data? I think that really looking at our policies, right? And so we're looking at it through a race equity lens, and how do we really build that out and look at our current policies? Some of the things we're doing at the state level, and I hope you all will be able to jump on board and support this, is looking at the barrier crimes. Allison was talking about the support for kinship families. And one of the areas and the reasons we have a lot of children in foster care is because there are barrier crimes that really exclude families from being able to care for their own kin and their own family members. And we need to address that and fix that. Barrier crimes in Virginia have a higher standard than the federal standard. And so that's something that we're looking at mandated reporters, looking at what comes into the hotline. How do we really separate that neglect, that poverty we were talking about? And so really taking a look at that and looking at how we put our legislation forward. So we're coming up on the 2021 General Assembly cycle, right? And Alice and I were actually just talking about this as we were coming on this meeting today, and how we're coming together to really look at adding impact statements on our legislation and on all of our fiscal and budget packages that really look at race equity impact, and be able to put that as part of it. We've actually done that in the session that just went through with the special session. And so being very intentional and meaningful about that, and looking at practice, looking at how we engage, looking at that mistrust, that paradoxical approach that we have as a child welfare agency. How do we help you when you didn't ask for help? Do you need help? And how do we do that in a way where there can be trust? And that's something we need to continue to work on. And looking at new practices, such as race blind practices that could happen at certain decision points. There's different places in Virginia looking at that, in New York. And I'll give a shout out to two folks who I think might be on this line, but I'll give or on this call, is Gwen Castillo and Gregory Sampson, interns at the state office who did research and literature reviews on race blind practice and really have led our efforts in the state to really take a look at this and see, is this something we should be looking at and doing? And I think looking at workforce, which I'm going to hold for a later question, but also talking about collaboration and partnerships. Allison brought this up. The child welfare field cannot do this alone. And we really need to look at how we can truly collaborate and partner. And we're embarking on that in Virginia, looking at primary prevention, but really how child welfare is more somebody who comes to the table than is leading those primary prevention efforts and can partner. So those are the ones that I would start with. And I will turn it over to
I just had a quick thing to say before Danica, because I know she's going to talk from the local perspective, but I know there are a lot of students and employees of private nonprofit organizations who are listening, or a lot of students who plan to go the nonprofit route and might think, oh, this isn't talking about me. This is also talking about you and your organizations, and I need you to hear this. Sometimes we think that we're doing things a little bit better because we don't have the red tape of government that is intervening in our ability to serve children and families, especially for organizations who are doing direct service to children and families. But as a lot of folks may be seeing, there's certainly a reckoning happening in the nonprofit sector around race equity. Some of it is because of the way we are getting our funding, but also there's just like a heightened awareness that nonprofits and organizations like that are not exempt from white supremacy culture and how we provide services. If your organization is dependent upon removal of children to provide your services, think about that. You have to take a step back and say, why are we dependent upon? How can we be a part of the root cause solution? That's not to say that there won't be children that need that level of intensive supports, but you have to take a step back as an organization and say, maybe we need to do things a little bit differently because we are probably a part of the problem and not a part of the solution. The other factor for a lot of these organizations is looking at their internal culture. You know, if you have folks of color on staff and none of them are in leadership or feel like they can get their points across and things like that, that is just the same as the system that we are talking about, and it can be oppressive as well. So I wanted to make sure I mentioned that to make sure folks didn't feel like they're off the hook, you know, especially if you're working in a mental health service or something like that. It all impacts child welfare at the end of the day. So I know Danica had some to share from the local perspective.
No, thank you. You know, I think it's, you know, Kristen mentioned looking at the data is so important. So I was so glad that the state has been looking at that data and what that looks like for Virginia's youth. And it really is important for us to do that at the local level as well, because we might find at a local level that that disproportionality is even greater than what we see at a state level. And if we see that, then the first question is why? You know, what are some of the practices that we might have that may be contributing to that disproportionality? You know, and one of the things that really comes to mind is in terms of family engagement. That is something that we really value in our child welfare services here in Virginia. And really, you know, wanting families to be partners in this process. Yes, that's something that we value, but is that something that we always do? And so I was listening to someone recently and they were talking about, you know, it's almost like we invite families over for dinner and we offer them a seat at the table with this pre-planned menu and just tell them to eat, versus asking them in advance, well, what would you like to have, you know, to ensure that, you know, it's a meal that they would like. And that's sort of what we sometimes do with our families, where we go to them and we tell them, you know, well, this is what you need to do in order to safely parent your children, versus us hearing from them about what they truly need. And sometimes their needs may be even more basic than what we're starting with, you know, in terms of our service plan. So I think really examining our practices with family engagement being one of those first things that we look at. Another area, you know, we like to do icebreakers when children enter into foster care, where the biological families and the foster families, they come together. And it really is an opportunity for foster parents to hear more from the bio family about different things about their child. But, you know, as I've been going through this, you know, I'm thinking, what types of cultural questions are we asking? You know, like, it's more than just a bedtime routine and, you know, how you calm children down and things of that nature. But what are some of the traditions that, you know, that individual family has? We can't just assume that, you know, if we read and learn about families of color, that the traditions are the same across the board. They're not. You know, traditions are individualized for every child and family that we encounter. And so it really is taking an opportunity to hear from that child and hear from that family, you know, what is important to them, and us honoring and respecting those things.
And then Danica, I just wanted to add really quickly, because you made me think of a great point. I always give the example, if I have a 2.5-year-old son, the conversation that I am going to have with him when he gets his learner's permit and how his interactions need to be with police are very different than my white friends who have children who also are white. And I always say, if my son were in foster care and he had a parent who didn't understand that bias and that it could be life or death for my son, and trusting the state to ensure his safety is the same kind of experience that a lot of our foster families go through. So I know we need to turn it back to our moderators since we have a lot more to cover.
Thank you guys for the information that you shared and many great insight about what the local and the state and different agencies can do in helping with this conversation. And what's to know from the history of the child welfare system, as you talked about, Allison, and different insights from other panelists, that it is difficult for families of color to seek help and support from the child welfare system, even when they have not committed any harm to their children. And children of families of color are overrepresented in the system due to some issues of poverty, such as lack of housing, rather than abuse and neglect. So how can families of color trust a system that has historically not valued them? And to delve more about this and how we're talking about importance of prevention, what do you guys think? How can we reimagine a system of prevention? What do families who are likely to be involved in the child welfare system need most?
This is such a great question. I'm happy to start and then have others join in. I think what Kristen talked about with the organizations themselves have to acknowledge the systemic racism that they have contributed to the community. There have been other states where systems of child welfare or mental health services have actually made public statements that have said, we have in our past, in our history, created harm to our community, and here's how we are going to work towards changing that. I think that's one tiny step forward. Some other things that could be helpful, I always tell people when I go to a meeting, for whether it's at the state or a locality or an agency, I'm like, I shouldn't be the only person of color in the room, and I also shouldn't be the only person with lived experience in this room. Because if we're making decisions about how we're going to serve children and families better, we can't do that in a vacuum, and we can't do that without asking the population or people that we're going to serve what they actually need. And then we also have to be willing to accept the answers if they don't fit into our framework of how we've been doing things, since this is just how we do it. Sometimes the answer is families just need cash assistance. And if that's not what we're willing to hear, we're going to throw all these other services at them, it's not going to work from there. And then I think lastly, I think other panelists will get into this, is how we do prevention services is so critical. Prevention services, I don't want to get too technical because I know we have lots of learners on the call, but there's different levels of prevention services, and some of them are at the absolute base that get to poverty. And that's what some of the things that we aren't currently investing in that we have to do. But we also have to look at, sometimes we are funding the same exact organizations and then we're just shifting it into the prevention services. We need to also acknowledge that families of color are turning to certain resources in the community. Those resources are often underfunded. They don't have the dollars to do the evidence-based evaluation that takes a long time and a lot of dollars. And we as a state sometimes have to say, we need to prioritize those organizations because they already have the ties to the community. They already have the community trust. We have to build relationships with them in order for families to trust the system as it is currently set up and be able to adjust. So I'll stop there and let my other panelists join.
Thanks, Allison. And I'll say from the macro perspective, you know, my history is that I'm a child welfare social worker and a therapist, and so I very much like to stay in the micro area. However, I work in a macro setting, so I will defer to others for the individual side of that. But I think that one of the things we want to look at in prevention, and Allison brought this up a little bit ago, is the funding. And one of the things that really drives child welfare, if you look all the way back to CAPTA, which started in around 1972, CAPTA really sets up funding that supports and drives foster care. So the majority of the money that comes from the Children's Bureau really comes to support foster care. It doesn't really come to support efforts to not get children into foster care. And so if we take a look at Virginia, just in fiscal year 2019, we spent $353 million on foster care. And when I say we, I'm talking about the child welfare system, CSA, for those who know that, you know, the whole area. So $353 million in prevention. So for the department, what we talk about is to prevent children from coming into foster care. Not even really true primary prevention, but to prevent children from coming to foster care, we spent $60 million. So $353 million in foster care, $60 million in prevention. And that's because we need to be able to adjust our system so that prevention is seen as required, necessary. We need to have the funding, and we need to do prevention all the way from primary prevention all the way through. And so the communities should be able to get the funding that they need to be able to support the families in their communities. And that's really difficult right now. There is some hope. We do have the Family First Prevention Act that's coming in. I'm sure lots of you have heard of that. Anyone who wants to become an expert on that, call us, talk to us. We talk about it all the time. But there has been some challenges in getting the funding for that because of COVID and because of some of the urgency. And what happens when funding gets cut? A lot of times prevention gets cut first. For us in Virginia, we are fortunate that our General Assembly and our governor is very supportive of prevention services and keeps it on the table. And so hopefully we'll be able to see that as we move forward through the next session. I think the collaboration of partnerships are most important, and as Allison said, need to lead this work along with the families and the youth and the children. And I think that focusing on kinship has to be seen as prevention. And I'll say the other thing is we really need to work better at understanding the systemic racism with our partner state agencies, the health department, with benefits, with housing, with mental health, with substance abuse, with Medicaid, because those are the agencies that are set up to serve families that need housing, that need medical insurance, that need food, right? And that's not really the child welfare system. So how do we really come together to make it a system so we all can help families in whichever way they enter into our system without turning someone away, and then it becomes a crisis, and then child welfare ends up getting involved. So that's what I would say. And so all your advocacy, and we're really hopeful to be able to see Virginia continue to swing to the prevention side and really focus on that rather than focusing on all of our resources and efforts in foster care.
And you made some really good points just in terms of that collaboration. That's so key. one of the things that we really like to focus on is just the partnership with our school systems. That's usually where, our kids first come to the attention, of our school systems, and they're spending a lot of time there. So how do we partner with those professionals to give them the resources and help bring awareness as well, to the various issues that we've been talking about today? One of the things that we do is we'll offer consultations, with school systems about different things that they are observing, because we do get a lot of calls about poverty, neglect, and things of that nature. So making, our school social workers, our guidance counselors aware of resources that families can be able to access, and helping to create partnerships with them, so that they can start with those preventative aspects. I think one thing that's really important is that prevention, it really is a community issue. While it's something that, within the Department of Social Services, we value, and we're really looking forward to the prevention efforts that are underway, it is something that the community has to embrace, and that we are all responsible for the safety and well-being and protection of our children, and really needing to take that approach. A big piece of that is with a lot of the families that we're working with, especially those that are experiencing poverty, they don't have the same access to resources that can help them to be successful. So it's really focusing on, how do we increase their social capital? How do we give them access to employers, so that they're able to get jobs that are able to pay a living wage? How do we ensure that they're aware of various educational opportunities that may exist for them? Those are the types of things. Who are the informal leaders in the communities, and how do we partner with them to help gain the trust? Because there is a lot of distrust of the system. So we need to know who those influential people are, so that we can partner together and help get those resources out, because we don't want families to become dependent upon the system. We really want them to be able to have their needs met within the communities. But for some of those communities, we're going to have to help support them and put some of those resources and services in place so that they can be successful.
Danica, and I know our moderators are about to kill us, because we're all very passionate about this. But I'm also seeing some of the comments and the questions, and what you said about, there are already leaders in the community who are doing the work on the ground. I like TikTok doing the work. But if you're an organization and you're trying to figure out how to get people at the table, and some of y'all aren't going to like this, that's a problem. Okay, especially if you're a community-based organization, that is a problem. Why don't you have relationships with on the ground community organizers, folks who have ties to the community, and think about historically why your organization hasn't had either natural partnerships with them or helped lift them up in the community as an organization. So sometimes you have to take a step back before you can make steps forward to make change, because communities aren't going to inherently trust you. Even if you're an organization, even if you're a nonprofit or you're a state agency, they're going to say, where have you been? I've been out here in Richmond City, for example, for 5 years, working, organizing people, talking about dismantling racism. And now you're trying to come and have a conversation with me. That's cute. That's what they might be thinking. So you might have to take a step back and say, okay, I need to take off my professional hat, because that means nothing to the community. They don't care that I have an MSW or whatever, and say, I need to go to their table and just be a participant until I build some trust. So I'll stop there.
Awesome. Well, thank you all again for, everything that you have brought to this conversation. We've talked a lot about the disproportionality of children and families in the child welfare system. Allison, I know you specifically brought up having the representation, who's at that table and why that's important, because that representation does impact the outcomes for the families, be it outcomes because of trust, and be it outcomes because of the biases that we do bring into our work. This event, of course, is hosted by the Child Welfare Stipend Program. And, as students of the program, a lot of the reason that we're here is because we're interested in knowing and, what we should know prior to entering the field about being these agents of change and working within a system that was set up in a very racist fashion. So it's really important that we're all here and we've had this conversation. So I do thank you all for your insights. We are now going to move into a time of Q&A. So thank you so much for engaging in this important conversation. We have touched on many topics about disproportionality in the child welfare system, the connection between poverty and neglect, the leadership and the workforce, as well as some strategies for change. As we move into this Q&A session, we all want all of the attendees to this event to think about your role, whether you're working directly in a public child welfare setting, interning student, or you're in a child welfare setting that's not, public child welfare. Think about your role and how you can be an agent of change in this system. And if you feel comfortable, please share that in the chat as we move into this Q&A. But other than that, I do appreciate all of your insights, and I'm going to go ahead and transition it over to Abigail for this Q&A time.
Thanks, Johnny. And I would like to start with a question from one of our alumni. And she asks, although deprived and neglected children within the custody and care of the child welfare system is a priority, I wonder what is currently happening to address those children who cross over into the juvenile system or who avoid the child welfare system going directly into the justice system. These youth are often entering the juvenile system with high ACE scores and at a disproportionate levels. What can be done to ensure children receive services and support earlier? What needs to happen to improve the care while they are in the system so they do not fall through the cracks once again? And what strategies need to be implemented to reduce racial and ethnic disparities in the JJJ system? This is a very loaded question, so please feel free to answer any part of that.
So I can give it a start. I'm going to clarify that I do not work in juvenile justice. So just to qualify that part. However, we know how important it is to partner with juvenile justice, and in many local departments, they do have quite extensive partnerships and working specifically with crossover youth. So in Virginia, there's 120 different local departments, and different departments have different focuses based on the children that they have in their communities and around those partnerships. In terms of looking at it from a state level macro perspective, I think that that's one of the areas that we're really looking at in terms of prevention and what we can do with our Family First work and those opportunities, and looking at evidence-based services that are specific for older youth, that are specific for families who are working with older youth, and being able to better understand what we can put in place once it gets into what we would call tertiary prevention. Again, where we're really looking at is how can we support and lift up the community so that the community has the supports and the prevention that they need, so we don't have to get to juvenile justice and the child welfare system. Now, with that, you had all the questions around disparity, disproportionality, and Allison, I certainly would like to turn it over to you and hear your thoughts on this, because this is where it comes in with the racial profiling, and with this when we get into juvenile justice. And I think that opens, that door in a whole different stance of how I'm answering it from a macro systems response perspective.
Sure, and that's a really great question. We often talk about this population as crossover youth. Sometimes they enter the child welfare system and then are transferred to DJJ. Sometimes they enter DJJ and it's recognized that child should have come to the attention of child welfare many years prior. I always tell folks, if a child has in some type of interaction with DJJ, at some point, we as a system have failed them or their family for them to get to that point, often because the need that they had originally was not met, and therefore we're now seeing delinquent behavior or whatever the case may be. I think that we have to talk about and think about, in the same way that we did with child welfare, mass incarceration and over-profiling of communities and specific communities. There's some really great data in other states where they just looked at zip code entry for children and youth entering juvenile detention facilities and found that like more than 50% of their population was coming from 2 zip codes, right? So sometimes we can look even further and see that it's not an issue of that these children are behaving, badly or anything like that. It's really what's happening on the ground in the community. And I have seen, and I'll give to DJJ's credit, they have started making steps to reform their efforts. They are a system very much like DSS that has been built up over generations, over decades. And so pulling apart that onion takes longer than probably advocates would like to see. But there are some organizations like Rise for Youth who are organizing young people, helping them to be more involved in the process of the reforms of juvenile justice. So that's one of your particular interests. I highly recommend getting involved in that organization.
Awesome, thank you all. The next question is, how do we push these conversations forward on the local level? Oftentimes it feels very idealistic and sounds good during panel discussions, but it's not translated in the real work. How do we hold our colleagues and overall agencies accountable, respectfully and professionally?
And it's a really good question. And I really think it starts with leadership at the local level. We have to be willing to have these tough conversations. And yes, they can be quite uncomfortable to have. But one of the things that makes it really plain is the data. When you look at your data and you see the disproportionality and the disparities that exist, that gives you a good place to start and really start to ask the question, why? Why do these numbers look the way that they do? What are we doing that may perpetuate or exacerbate, what we're seeing here? And what can we do differently? It's not a matter of pointing fingers and blame and things of that nature. It's a matter of coming to some state of understanding so that we can move to action. And so I think, again, that the data, it doesn't lie. It tells the story. So that's a really good place to start and to just be curious about what we're seeing there to get those conversations going. I also think that we do have to look at, our workforce. We have to look at, who we have in leadership. We have to look at our staff. Does our workforce look like the communities that we serve? And if not, we have to acknowledge that. We have to acknowledge that implicit bias, it exists. Even I, as a Black woman, I have biases and I have to be aware of that and how that may influence some of the things that I do or some of the decisions that I make in working with families. So I think just that openness and that self-awareness, that those things are going to be key.
That's such great advice and information. I think we have a lot of students who, I think Kristen alluded to it earlier, you're going to come into the field having listened to webinars like this and been in class where you talked about dismantling racism and you are ready to go into the field. And then day one, they're like, you are very green and you don't know what it's really like to serve families. Wait until you walk into a house and you see all these kids and you see how hard it is. You won't be caring about, dismantling racism. So part of it is going to be remembering when you are in the field, why you wanted to go into the field and how you wanted to change the field. And what Danica said, having some hard conversations, sometimes it's finding allies in the organization, some who might be a bit more seniored, and coming to them and saying, I really want to take this on, can you join me? You might be able to start a race equity work group at your local department or local agency, and so that they can see that it's not just you. I wish I could say that talking about race equity doesn't always put a target on your back, but I don't want to lie and say that because I know the realities of our workforce, and I know that for some of you it might be a much greater risk than it is if you're working in Chesterfield with Danica, who's more open and ready to have those conversations. So sometimes it's find the allies. They are there, especially when you are brand new and you're meeting different people. You can kind of just make a list of people in your on something and and have some conversations with folks that are ready to get the work going.
Thank you, guys. And in talking about prevention, a question that was asked is, how can we begin to give parents and communities more tools in their toolbox so that we can prevent foster care and help families stay together?
I think that, you know, for me, when I hear this question, I think that it really comes down to believing in families. You know, this is why we come to work every day, right? Because we believe in families. And so believing in families and believing that families know what they need to do. And they know what they need to do better than we know what they need to do. And so what we need to do is back to what everyone's saying, be able to hear. But that's if we come to the table. Where we're really looking at is how can we really get ahead? And, you know, it's interesting being on this call because I think back to when I was in school, and you know, we really learning about macro and the difference of macro and micro social work, and looking at the waterfall, and like Allison was saying earlier, we're looking at the leaves of the tree, right, instead of the roots. Really what you're looking at with this question is, what do we really need to do upstream? Where do we need to get all the way up the stream? Because we tend to do services all the way downstream. And what it is what is really out there in those communities? What is needed in the communities? How can we come together and fund the communities so they have the supports and the resources available to them in community centers, in these kind of areas? And I think there's a commitment in Virginia that we're really trying to look at that, and how do we move upstream, and how is it that child welfare, in terms of this system, in terms of our whole system, contributes to that versus just the agencies, and how can we come as supports and members of those multidisciplinary teams, but it really being led by the community, the families, the youth. And I think it does sound Pollyannish. I think that we are moving there, and we're seeing that, and we're able to see it in our numbers. There's many folks on this call today that I see that do direct prevention, that are in it, and they see those outcomes, and we need to look at the research, and we need to learn from them, and we need to be willing to take risks and test what's out there, and listen to families. And then when we need to do it different, do it different. And I think that's what we need. That's what we need to do, is be able to have a path forward where we all have the commitment that we're looking at supporting children, families, and youth, and the communities, so that people can thrive in their communities and not be dependent on a child welfare system. Or is the child welfare system dependent on the families, as Allison said? Which way is up, right?
And just to add to what Kristen was saying, I think something that was impactful for me when I was in the program, someone sort of said, I'll just speak to Black families specifically. Black families have survived slavery, Jim Crow, mass incarceration, and have learned how to navigate and raise their children despite these institutional and violent, provocative cultures. We have to learn from them, right? Like, think about that. If you were able to navigate through all of that, there are some skills that the families and communities have learned along the way that we're ignoring in some of our white dominant culture of how we are viewing what is a good family and how to raise families. So that's something to consider as you're trying to ponder that question.
Absolutely. So this next question in the Q&A is actually going to be directed toward Jamie and Naomi. It asks, is Trump going to get anywhere with his attempt to defund schools that are teaching about white supremacy and race theory? They attached the quote in there: all agencies are directed to begin to identify all contracts or other agency spending related to any training on critical race theory, white privilege, or any other trainings or propaganda effort that teaches or suggests either one, that the United States is inherently racist or evil country, or two, that any race or ethnicity is inherently racist or evil.
collect my thoughts on that. I will say that executive orders follow the executive. And since, come January 20th, 2021, we will have a new commander-in-chief, that executive order will not stand. However, the fact that it was put in place and it's become something that is public and has been out there, and something that institutions of education at all levels, K through 12 and higher education, have been figuring out what they have to do with it. It's something that needs to continue to be addressed, even though it won't go into play and schools won't have to worry about it. It's an idea that has been put in the atmosphere. It is something that some people have already accepted and have begun to adapt to. So it's something that we have to continue addressing in institutions of education. And it's something that it's important to not just say that we'll have a new commander-in-chief, so it's no longer there. The idea is in people's head now. The concept is in people's head now. And policies at different schools have already been enacted to address this and to adapt to it, and to begin not to teach these things, to begin alter how we talk about race, racism, sexism, all the isms. I will say, I can't speak for VCU as a whole. I can only speak for Jamie. I can't. This statement is not supported by the VCU. But I will say that we would not be here in this webinar today if Naomi and I had chose to follow the executive order, because this completely contradicts everything that it says in that. And that we are committed to teaching our students the truth about history, the truth about the child welfare system's history, the truth about the history of the social work profession, how it was created, what it was grounded on, and to use history to change the future and to do better, to really understand the white supremacy and the sexism that exists in all these institutions, and what we need to know about that to move forward. So I think that it will have an impact on some institutions, even though it won't hold, and that the goal is that we have to acknowledge that and really fight back against that, and to continue to do the work, continue to hold these webinars today, even though it goes against the executive order, continue to do the work. And continue to, I think Kristen said earlier, be bold in addressing these issues, and to, just stand on the right side of history, and to really do what's right. And sometimes we know in history, the right thing is not always the legal thing. The right thing is not always following what the government has to say about what you should and should not be teaching. And, as for us, me and Naomi, she didn't tell me I can speak for her. So, but as Naomi and me, that we will, as long as we have this platform, continue to teach truth to power, and to hold webinars and allow people like Allison, Danica, and Kristen to talk about the truth, and to teach our students and our community about, just to be truthful.
Thank you for that, Jamie. And you answered so well. I won't add a lot to that, other than we must be vigilant to follow our social work values. And we have to uphold those, even when it's tough, uncomfortable, and potentially illegal, right? So that's all I'll say for now, because I know our moderators are looking at the clock, so I'm going to let them continue from here. I see that we have lots of great questions in the chat as well, and if our panelists have time, maybe they can type some of those answers in. We certainly are seeing lots of opportunities for additional webinars in the future, but I'm going to send it back to our moderators.
Thank you, Jamie and Naomi. And for the sake of time, I will ask the last question, but we'll try to answer some of it via chat. So the question goes, what is an appropriate role for white allies in advocating for change in our system? And how can white allies navigate these conversations? It's important to not make assumptions or drown out the voices of people of color, but it's also important not to leave the responsibility for fixing inequities to people of color.
I'll quickly answer that because I know we are almost out of time. One of my favorite authors and speakers is Dr. Joy DeGruy, who I've had the wonderful privilege of hearing in person. And she often says, you're either an ally or it's all lies. You can't be my friend and my oppressor. And so I think you, as an ally, it often takes time. And this is probably the hardest part for students to hear all the time, is that they want to come into the organization and be an ally. It doesn't work like that. It takes time, it takes showing up, it takes when a person of color is speaking or trying to get their point across, it's sometimes when you as the white ally say, actually, Allison just said the same exact thing, or you just interrupted out. Like those type of things over time will develop your white allyship. It will also be incumbent upon you to sometimes state what is the obvious. And I tell this to my students who are in my class or who are my interns. I'll say, you already knew what needed to be said. Why didn't you say it? Why did you wait on the people of color in the room to take the risk to their career to say it? Those are the things that will make you distinguished to become a white ally. And I often say, you won't even notice sometimes when people are starting to associate you with a white ally. You'll just get invited to more things. You'll be asked for your opinion more often. Someone might come to you and say, like, I know that you're going to be so helpful in this meeting, and I appreciate the way that you work with me. One of, I'll give it, I think she's on this call, but Valerie LaRue at Virginia Poverty Law Center is like the example of a white ally. I don't have to wait for her to take up space when something inappropriate is happening or something that is deeply rooted in white supremacy. She says it exactly how I might have already been thinking it, and recognizes that it's more of a risk to my career to have to be the one to constantly bring things up. So recognize those things and recognize the time that it will take in your career to develop and to be viewed as that by your colleagues.
Absolutely. Thank you all for these thought-provoking questions. We recognize that this is an ongoing conversation, but we are nearing our time today. So then unfortunately, that is all the questions that we can respond to. As a reminder, this webinar is recorded and a link will be emailed to you. We will also include the resources discussed by the panelists today, some of which will definitely be helpful to this conversation. If you have additional resources to share or ideas for future webinars, could you please add those to the chat so that we can work to incorporate those into future sessions as well. We would also appreciate it if you take some time to fill out our feedback survey. The link will be provided in that email. This will help us to continue to improve our future programs. But other than that, I really appreciate everyone attending today.
And thank you so much to our incredible panelists, Allison, Danica, and Kristen, for taking some time out of your busy schedule to join us for this important and necessary conversation on how we can improve the system and better support families of color. We would also like to thank the School of Social Work Leadership and Community, in particular, Jamie Cage, who is the assistant professor, Jeff Locicero, who is the director of communication, Nicole Passamore, who is a communication specialist, and Anna Givens, the development specialist, for all the wonderful work they did in the background of putting this webinar together. And lastly, we would like to thank the incredible leadership of Child Welfare Staffing Program, Rebecca Gomez and Naomi Reddish. Thank you so much, Naomi, for putting this webinar together, recognizing the need of bringing together community partners and including us students in this conversation about the impact of systemic racism and disproportionality in the child welfare system, and how we can all work in doing our part in advocating for an equitable system. So thank you so much, Naomi.
And thank you to our wonderful moderators who have been so proactive in their work and their learning. Thank you to our panelists for your commitment to this work. And thank you to the audience for joining us today. You are crucial in this conversation and the work that needs to be done moving forward. So we plan to continue this conversation with you as we work as a community of social workers on advocating for racial equity in our communities and our child serving system. So we hope to see you again soon in the community, on Zoom, and all the other ways we communicate these days. Thank you all for joining.